big area, and we'll cover as much as we can today. But any questions, send them in, and I can get back to you if I don't get to them today even. So what we're looking at here is the British recommendations for fitness. Sorry, just checking my screen there. I'm clicking things. I'm just making sure it's not popping up in front of you as well. Okay, so this is the British recommendations. We wouldn't be far off it. As time has progressed, it's become a little bit more cohesive across the world. I mean, people have different boards have started to come together on what they perceive as the optimal health and fitness for pregnancy. Now, apologies, I'm emming all over the place, but once I get going, there's no stopping me. Okay, so what you're looking at is throughout pregnancy, they say to aim for at least 150 minutes of moderate exercise every week. So moderate exercise would be 50 to 70% of your maximum heart rate. Now, for those who are fitness professionals with us or in training, you know that your maximum heart rate is 220 minus your age. So that's moderate, what they recommend. On now. Yeah, will I be able to send it the slideshow? Yeah, sure, why not? It'd be a lot easier to go through the slideshow later on yourself and write things down. Right now, you can just follow along with me and I can send it to you for sure. It'll be in PDF form, of course. Okay, so this is what they're recommending. At home, that you keep active with the kids, do a bit of yoga, make sure you're moving up and down the stairs if you have one. Trust me, towards the end of your pregnancy, you're going to be looking for stairs to walk up to try and bring that on, if I remember correctly, and the curries. Out and about, just to keep active. They're saying you can lift, you can go and do your shopping. Obviously, this is just general. It doesn't specify which woman, and everybody is different. So you do have to take your client into consideration in a massive way in this whole thing. Swimming always is a positive because you have no impact. There's no weight, well, less weight. The water lifts the body and takes some of the weight out of it. So it's a little bit safer. Dancing and stair climbing, like in the gym, you're a stepper. So from my own experience, I would have cycled. I was a spin instructor during my second pregnancy, and I was able to keep that up for a while, but we'll get to this later. The pelvic floor and the pelvic girdle area can be a little bit uncomfortable during pregnancy, so you may not want to continue cycling for long. It depends on the woman again. So this is very general information, and you need to apply it to the situation we're dealing with. So, situation, poor woman, the lady we're dealing with. Okay, recommended to do muscle strengthening activities. Reason being, obviously, you're going to have to be lifting the baby. You're going to have to be moving cots and prams and car seats and everything, so to keep active and keep your body functioning to the best of its ability. Now, if you're unwell during pregnancy and you're not able to, this does not apply to you, because the main thing is that you stay healthy and that the baby is healthy. So if a woman is not in a position to do any exercise due to illness or any kind of pelvic issues, and she's been recommended bed rest, that's what she's to do, and she can come around to do all of this later on. There's plenty of time for that. But this is your average client. So if someone is not active when they get pregnant but decide they want to be, it's not generally the best time to start anything, but you can move. You can start walking. You can start doing a small bit, but you start gradually. You don't get hell for leather straight in like you would. Another question here. Muscle strength training. Would you lower the weight and increase the reps? In general, possibly, yeah. If it's your general client and you just want to do toning, some people hate that word, but women love it. If you just want to maintain tone, then you could increase the reps and lower the weight. You could also keep the reps the same and lower the weight. It's just maintenance really at that point. But you'll have clients who are into their strength training. They're into building muscle, and they're not going to want to wean off a bit. So then it's going to be about changing the exercise to suit the situation, or the stage of pregnancy. So with me, I stayed in the gym and I was doing all my weight machines, and I was doing push-ups. Everything I was doing before, I was doing it when I was pregnant, without being aware that I should be minding the diastasis, the separation of the stomach, or just being conscious of my core. I wasn't aware of that at the time, and that's the only change I would have made, really, is consciousness of the core and making sure that I think I still did sit-ups late into the pregnancy because I could. I thought, I can do this. So that's the reason people don't is because they can't. Well, I can. Well, that's not the case. Unfortunately, I was exacerbating a situation. I was extending that diastasis, making the separation stronger. So it wasn't ideal. And looking back, would I change it? Absolutely. But it wasn't a huge problem that couldn't be rectified. We'll get to that anyway. So I'll be coming up a little bit more on, will this video be available to look back again? I'll find that out for you before the end. I'll send a message to the boss there and see. As it's a course, I'm not sure. Normally our webinars are, and then they go live on Facebook as well. But as I can see, this one might be live too. Bear with me, leave it with me. And what we'll do is we'll post underneath, or we'll send you an email later. We'll cover it, don't worry. Okay. So yeah, there's no evidence of harm of exercise. Listen to your body and adapt is the main thing to remember. So the woman you need to listen to your client, and they need to listen to you a little bit as well. Okay, so they're aware of what's going on inside their body, but you're aware of the physiological or psychological situations that may be going on that could impact. So to work together, to take in what your client is saying. So when you're working with a pregnant client, and again, I'll come back to this is only a little kind of a flash in the pan and we're going to go deeper, but when you're dealing with a pregnant client, your screening form, you have a screen every day. And you might do that with clients anyway, but this is more, how are you feeling today? Have you slept? Do you feel energetic? That kind of stuff. And you work off that response on that day as to what you're going to do with her. I'm saying I'm very subjective about the poor client. I'm putting myself in that situation. So I'm thinking of me. But what you're going to do with her depends on how her day is going, what she needs that day. And as the stages of pregnancy go on, it's going to be different. At the start, she may want to stay fit, and she might have great ideas about having loads of energy. I tell you, I did for definite. And as the pregnancy progresses, it might wean off a bit. Her energy levels might reduce. They generally do. The more the baby grows, the less energy you tend to have. Some people are great. Everybody's different, as I said. Some people are great and they're just boundless energy. I wasn't. I went for a 10-minute walk and I needed to go home to bed. I mean, that could have been partly in my head because I'd go to the gym and I'd do a 30-minute session and I wouldn't feel as tired, So I think where your head is at that moment is very important as well. And then you've all the hormones flying. So definitely to be aware of a lot of things. Okay. So if you're exercise programming, you don't want to go above that moderate intensity exercise, basically. So that 50 to 70% is plenty, and that's your cardio end of it. That's your heart rate when you're exercising. So let's move on a tiny bit and we'll see what comes up next. Okay, so resistance training here. Again, these are just infographics that I found from different parts of the world that are recent enough, and I thought there was something in it that we could use because, as I said, everybody's different and you need to apply as much information as you can gather to the individual. So, for example, a resistance training idea would be a press up. Now, this is earlier on in pregnancy. If you were going later in pregnancy with a press up, you could do it elevated against a wall. I would refrain from putting in any prone exercises, downward facing. So a full push-up, I wouldn't recommend, especially later in the pregnancy. If the client is super fit and exercises all the time and they're an athlete and they're doing push-ups, they'll be able to manage for a while. But once that center of gravity changes, there's the changes that are going to have to be made. She might need to go to the knee for a plank or a push-up if she can control the core with breathing, and the pelvic floor is involved. There's a lot involved there. So for the general client, you could do the press up but elevated. So you're taking that gravitational push out of it. So you could put her on a step, again subjectively talking about the poor client, against a wall, those kind of things. Tricep dips, again, you're keeping the upper body active, therefore the back of the upper arm, and it's body weight control, so not so strenuous. Upright row. When you are doing an upright row, you are working the mid back. And when we look at posture in a few seconds, because I'm going to have to speed this up, I teach very slowly because there's a lot to give out. But when we look at posture, upright row is going to help with that forward shift we're going to find in the core and the shoulders. So let's just have a look. Body weight squat, again, it's controlling your own body weight. Aware of intra-abdominal pressure. Needs to be breathing correctly, at least inhaling and exhaling throughout the squat, so that they're not building up that intra-abdominal pressure, and that can put pressure down on the ligaments and tendons of the pelvic floor. Lunges, none of us will be too fond of those at the best of times. If you haven't done them in a while, you'll know when you've done them because they're sore. But again, it's body weight. Earlier in the pregnancy, all of these, no problem in any way they tend to do them, really. But as you move on in the pregnancy, you're going to have to be aware of posture. Center of gravity may have shifted, so will have shifted. So with a lunge later in the workout or later in the pregnancy, you might want to do it with, as if you were working with an older adult, something beside them to stabilize them. Now, just to have to hand, that if they needed to tip their hand off it, they could, not to be resting on it if they could. Again, all different clients, you work the best you can with the client you have. So if they aren't able to do a lunge without holding on and you want them to do it, that's okay. It's a short stage of their life, pregnancy, and it's about keeping them active and moving if they want to be, but also not putting them down about what they can't do. There's an awful lot of that. Women know what they can do and what they can't do, and if they try, they'll find out fairly quick if they can't do it and be the first to admit it, because they don't want to harm the baby themselves. So calf raises, again, something very simple, but you're toning the muscles of the calves, toning again. But also this kind of movement helps with the blood flow. It helps with sitting all day. It helps with, and that's forced sitting, because as you progress through pregnancy, you don't have the choice. Sometimes you need to sit. It is going to help with your balance. It's going to help with that center of gravity change and postural changes. And that's only a suggestion. That's not the only ones you can do. What breathing techniques to prevent pelvic floor pressure in the squats? Have you heard of the Valsalva maneuver? Basically, you don't want that, and that means holding your breath. If you hold your breath, you are increasing the intra-abdominal pressure. So you want them to breathe through it. Generally, with exercise, we would recommend to exhale on the effort. So for an upright row, you'd inhale when the arms come down, exhale when the arms come up. Inhale when the arms come down, exhale when the arms come up. Now, very bad upright row because I'm sitting, but just for example, breathe out on the effort. You don't want to overcomplicate it. It's just to give them every chance they can of building strength without weakening any core area. Okay, another question there. Oh yes, that was, yeah, I'll come back to that question anyway again, Bernadette, about the recording. Okay, so what is important? What is important is we have to be aware of posture changes. The woman's body is going to change. There's going to be a pull to the anterior, to the front, as well as that, that's going to shift a lot of the weight off the certain joints. So if she had good posture before, she may suffer now. That's going to put a little bit of pressure on, say, hips, knees, ankles, that kind of thing. So just to be aware of it. It'll also shift her center of gravity, as I said, so that's her balance. So things like lunges or unilateral exercises are going to feel a little bit less stable. Intra-abdominal pressure, as we said, just to breathe. Again, not to complicate. You can go into a whole different variations of ways of breathing, but exhale on the effort. That also helps you with the lift, or helps you with controlling the muscles that are lifting. Pelvic floor and pelvis stability or control, pardon me. Okay, so pelvic floor is not something we think about all the time, and we do need to maybe not all the time, that's a bit excessive, but we do need to during pregnancy, because the relaxin, that's a hormone that's released into the woman's body that relaxes and loosens ligaments and makes her more flexible. That can be problematic as well, because the core and the pelvis are less stable than before. They're a little bit more loose. So if you're standing up doing exercises, you have to be aware that the pelvic floor, that normally is a strong basket holding in your insides, that's just a little bit looser, and now it's under the pressure of weight of the baby as well. So maybe we take out the standing exercises towards later pregnancy, or we reduce the amount of time we're standing. Here I am sitting with the pelvis. It's You could have the client sitting, depending on their comfort. Again, all depends on the client. It just means that when your client comes in, you don't just hand them a program and go, this is what you have to do. You need to consider these things when programming it. So her pelvic floor needs to be controlled and worked. So you can do that with a glute bridge or a glute raise. Cueing is what's different. So how you would cue the exercise is a little bit different than if you were lifting weights. Right? Hopefully that didn't change anything. My cable was coming out. So similar to Pilates in that you would look at, for a glute bridge, you would look at rolling up from the coccyx, but you would look at starting with the pelvic contraction, pelvic floor contraction, pelvic tilt, then into the coccyx, then up through the spine. Do you know, so it's your cueing that's going to change. We need to also make women aware during pregnancy of where their stomach muscles are, because later on we're going to ask them, if they keep coming back to us, and post-pregnancy, we're going to ask them to activate their TVA, transverse abdominis. So bringing their awareness to where those muscles are is going to help you later on as well. So starting with the pelvic floor, teaching a client how to contract and relax. And there you have two separate elements there. You could have someone who can't relax the pelvic floor. You can have someone who can't contract the pelvic floor, and variations of in between. So even that is diverse. So as I said, we're tipping an iceberg here with a subject that if you really want to go down the line of dealing with clients with this, you're going to have to invest and delve a bit more yourself. But this is where we start, awareness and just a little bit of understanding. So also your core and your abdomen. Women will want some sort of core or abdominal strength because it helps with pushing. That's why I thought sit-ups, wonderful. And they helped with pushing. Fitness helps reduce the fatigue when in labour as well. So another reason to stay fit. But again, awareness of where the core is, keeping as much strength as you can in it without putting pressure on the diastasis or in a prone position. So you could do your side planks if they were in a position to do it themselves. Again, different clients. When to cease certain exercises and why. So that's kind of an important one as well. So we'll come to that in a bit. Hopefully, the way I'm chatting here now, we'll be here all day. In the last trimester, the weight of the baby is, if you lie in a supine position, right, lying on your back facing the ceiling, the weight of the baby can put pressure on your blood flow. It can cause dizziness. It can cause restricted blood flow to the baby. So that's why they would say no supine exercises after, say, 16 weeks. Now, if you're a professional in this area and you're working with clients who are pregnant and you have experience, you may allow your client to lie on their back for exercises, but there's a huge but there. You would make sure the time is reduced, that they were aware that they could roll to their side if they needed to, if they felt any dizziness or discomfort, I should say. But it's very much your responsibility to make sure that they're not on their back for too long. They do a certain amount of reps of whatever exercise that they're down there for, because even with the glute bridge, you have to start on your back. But again, you're lifting the glutes, you're coming off that artery that we were talking about. So it's not consistent pressure lying on your back, which is the one we need to watch out for. So there's very many reasons why there are exercises we should do and shouldn't do. Let's look at the posture. So as pregnancy progresses, the center of gravity moves. So the first picture there on the left is semi-perfect posture. You're looking at a 35-degree curve in the neck and 35-degree curve in the lumbar or the lower spine. So the joints are stacked and the pads are supporting because everything is aligned in the way it was designed to. Okay, so then the second picture, the pelvis is starting to shift forward. So the coccyx is lifting. See the bottom, the little curl in there on the bum? That's lifting. It's going to put a little bit more pressure on the lower back. Again, looking at our posture, the hips are after shifting position. The weight at the front is going to pull her forward. There's going to be weight from the chest, the abdominals, the stomach, not the abdominals themselves. And as it progresses, the angle and the pressure gets greater on the lower spine. So the center of gravity moves forward. Neck extensors tighten and shorten. So the muscles in the neck that extend the neck, they get shorter and tighter. It's part of the postural change to balance out that shift in the center. Mid-traps, rhomboids lengthen and tighten. So that's in the center of the back up here. So when we were talking about upright row, there was your mid-traps. So they are lengthened and tight where they should be strengthened and tight, I suppose, but not tight. So the lengthened part is a problem there. And the reason they're tight is because they're overstretched. The pectorals, that's at the front here, they shorten and weaken. So they come in. And now the muscle isn't working as much anymore. If it was working, it wouldn't shorten. It wouldn't allow that shortening. So all these changes are things that we need to be aware of so we can work with the client after. So if you're looking at what's changing here, these are where we're going to work when she comes back to us after having the baby. So we look at loosening the neck extensors, working them. Mid-traps and rhomboids, we would work those to bring the shoulders back. The pectorals are short and weak, so we could work those on a different ratio to the traps and rhomboids, but also stretch them because they were shortened. Rectus abdominis lengthens and weakens, so all the way down the front of the stomach, that's your rectus abdominis. You have two sheets of abdominal muscles, and that's what separates to allow the baby to grow. Not always and not in every client, but they lengthen and weaken because that dome is pushing out and you can't work those muscles so much anymore. So then we need to work those later, but after we deal with the rectus. In any doctor app, they'll have you lie on your back in all checkups. It's the crunching, getting up off the floor, dizziness or cramping. I find the main problem. Would you avoid it altogether or allow it for short periods of time, as you said? Yeah, that's a very valid point, Phil. Phil was saying that if you go to a doctor appointment, they have you on your back. They do. It's ridiculous what they advise not to do, and then you see done, and vice versa. Yes, it's awareness of the situation, awareness that weight can put pressure on that artery and can cause dizziness. Just awareness of it. I would definitely allow them to lie on their back, but I would definitely get them to roll, advise them that they can choose to stop the exercise and roll to the side if they need to. So I wouldn't advise it or avoid it altogether. Again, depends on the client. If you're looking at blood pressure issues or anything like that, you probably won't have them in your class anyway. But in general, I would say do it and ease off, give them breaks. Okay, so hamstrings lengthen and tighten, that's your thighs, the back of your thighs. If I'm looking at this now, I'm thinking these are all the weaknesses I still have 3 years later. Posterior chain shortens, that's the back of the body, shortens, frontal lengthens and weakens. So you have a balance issue there then again. Sorry, there's movement outside my window. No problem, Phil. Okay. Implications for exercise. I'm going to scan through these kind of quick-ish because they're kind of technical. Lumbar changes. So reduced ROM in the lumbar spine. So the lumbar spine, the bottom, has reduced range of motion. So you have reduced ability to maintain correct pelvic alignment. So your pelvis will shift to do with the lumbar spine changes and the weight of the baby. I actually still have a anterior pelvic tilt from my pregnancy 3 years ago, and if I don't fix it, it's going to stay there. And definitely I have sore knees as it is. I have one bad knee joint, and it's been feeling worse since, and up into the hip on that side, and it just starts to spread. So most of us ignore these things and take it as nothing we can do about it, but better to actually deal with those changes in minute ways and get you back to some sort of balance. Could you work on all the postural problems after births due to body changing before birth? Or because the body changes with growth of the baby won't make a difference? Best leave till the end. Okay, so what Phil is asking there, Phil, sorry. What Phil is asking there is, can you work on these postural issues during pregnancy, or should you wait till the end because it's all changing? You could. You wouldn't be changing the posture during pregnancy, but you could definitely work on the areas that have been affected. It would lessen the response to the changes, if you get me. So say the pectorals are shortening and weakening anyway, your posture is changing anyway. Yeah, you could work on that and just give yourself a bit of relief. Your posture will shift to suit the baby, but then you're already in a good place to start when you come back out of it. It might limit the postural changes in some way as well. I don't know because I haven't seen a specimen. I'd love to. If anyone wants to give it a try, and let me know. We could do a little test, a little study on you. Okay. So reduced lumbopelvic stability. So that's your bottom of the spine and your pelvis. The stability between the two is reduced, and your hamstrings are dominant. So I would say, yeah, I'd be very quad dominant. It says here hamstrings dominant. I would think that my hamstrings are under an awful lot of pressure with that postural change, and the quads are going to be dominant more so than the hamstrings. Again, depends on the person, depends on the posture. So by the 3rd trimester, thoracic mobility is reduced. Thoracic is the mid part of the spine. So the big changes here are going to be spinal, and then the knock-on effect to the other joints, so the hips, the knees, the ankles. Once the change happens anywhere along the spine and the hip alignment changes, that changes the alignment of the joints. So with women already, we have a wider pelvis and shallower, okay? So we already have a tendency towards adduction at the thighs. That means the inside of the thighs tend to work together, work towards each other a little bit more, and that's just basically because of our posture, our build, not our make. Nothing we can do about that. But you could balance it out by working the outside of the thigh, of course, but we are prone to having that adduction at the thighs. Again, in squats, you're wanting to make sure that the client isn't over adducting. Again, that's going to indicate that they are working their pelvis possibly too much in a squat. There has to be that give and take. There has to be the ability to release the pelvic floor as well as contract it. So we're looking at a staggering effect, as in, the spine, there's a lot of changes. Restriction anywhere. So clients may come to you stiff and sore, and all they need to do is just move and work it out rather than try and build and reshape their posture. It's whatever works in that time. So poor alignment of all the joints and all the muscles crossing the shoulder joint. That forward roll of the shoulder, I still have it. So I think definitely working on good strength in the upper back post-pregnancy, once you're cleared, is the way to go to fix that upper shoulder posture. And that's going to bring back the chin just a little bit as well. There'll be knock-on effects from every little move. So it won't be a matter of having to step down through the body, but just take the bigger parts, and then you can refine later on what hasn't shifted along with it. I have another question there. Those hormones, relaxin, affect all joints or just the pelvic area, everything. Relax and releases into the body, so you're relaxed. Yeah, not so much. I know we need to avoid stretching the pelvic girdle area, but would I need to avoid too much mobility in other joints to help fix thoracic change? Okay, yes, relaxin relaxes and loosens ligaments and tendons and everything in the body. Again, awareness. All it is awareness. So a client might need to be aware of it, that they can overstretch so that they don't overstretch. You're not looking at developing flexibility during pregnancy. You're only looking at stretching. And the difference is when you're developing flexibility, you're trying to go past the point that you're normally able to attain to advance the stretch. You don't want to do that in pregnancy because the stability isn't there. You can't, she will need to stretch, but just keep it in your static post-exercise stretch or your dynamic pre-exercise stretch. That would be enough during pregnancy. Mobility, you could always work on mobility. I would do mobility exercises, definitely. But again, keeping it within their range. So not extending or expanding that flexibility range. The effects of elastin last for a while after pregnancy too. So it would be best to be aware of it with the client. Again, it's just awareness. No, it doesn't. It doesn't leave the body straight after birth, the hormone. No, it doesn't. All hormones that are released into your body kind of hang around for a little while after, as you can tell by we need them, first of all, so we can get through that pain. And so we can forget about it almost immediately and think, oh, I'll have another one, nearly as you're lying in the hospital bed. That's a little bit of a stretch, pardon the pun. But yeah, so the hormones stay, they float around for a while. It depends on the client, depends on the person again, how quick the hormone removal is from the body. It depends on the efficiency of their diet, the digestive system, and all of that is up in a heap when you're post-pregnancy. So it does hang around. You just need to be aware. If there's any pain or discomfort, ease off. Simple as that. As much as you would do with a normal client, average client, you just have that little bit more awareness and a little bit more consciousness that the pregnant woman might need to reduce her range of motion a bit. You know, again, what you know can help, and telling a client about their limitations, explaining why there are limitations, even though they may not feel it. So like with elastin or relaxin even, it makes you feel looser and more elastic, and you probably feel like you can touch your toes all day and it feels great. But explaining to them the reason for it and the possible side effects should they overstretch can make them more aware of themselves and reduce the possibility by themselves. Again, you really have to rely on feedback from your client. So again, hips and lower body, changes in pelvic alignment, reduced support from the glutes. Glutes weaken. So now we have more weak muscles. Again, I have no glute strength. Don't know why. I do know why. I was pregnant, but I'm 3 years past and should be able to well sort that out. So it's just a matter of getting someone like one of you guys to give me a kick up the BUT. So yeah, so if these changes in the pelvic alignment, all the joints are affected. Changes in muscle dominance. So as we said, if certain muscles are strengthened or not strengthened, but under more pressure because of your body position, it's going to change the pressure on the joints. Again, it's 9-10 months. It's not going to be the end of the world, and many women have gone through it and never ever recovered any of these issues and got on with their lives and managed. No bother. The thing is, we have more knowledge now, and later on in life, those issues that used to come up that we thought they were just, you know, how things were. This is the process of it. You're here to make a baby, you make the baby, body changes, and you deal with the changes. Yeah, but now we need more information because we can actually help ourselves and help our clients to regain some of what they had before, even better sometimes. Yeah, absolutely, Alison. You need a doctor's clearance to return to exercise. Alison asks, regarding programs, would you start with body weight mobility exercises or introduce weights again? Exercise will alter if it's natural or C-section. That's very true. Yeah. I'm going to skip on a little bit so I can reach that point of the slideshow for you, because I know you're getting anxious too. See? So yes, absolutely. First thing you need is doctor's clearance when working with any client that has any health issues. You get them to do the health screen, and if with a pregnant client, doctor's clearance. You don't know what's going on, they don't know what's going on, and you need some sort of a heads up as to whether there's a blood pressure issue or anything that you need to avoid working with, or something the doctor recommends they do. All of those things, work with a professional. Health screen, as we said, so a daily pre-workout check-in to see how your client is feeling that day. Okay. I'm not forgetting you, by the way, Alison. I will come back to that in a couple of minutes if I don't cover it before we finish, but I think I will. So during pregnancy, warm-ups and cool-downs are essential, and it should be gradual so you avoid blood pooling. So that means that you also need to look at blood pressure and your heart rate and all that kind of stuff. So gradual is the best way to go with pregnancy. Every client, but pregnancy especially. Includes strength and conditioning for pregnancy-specific muscles, so your pelvic floor and your postural muscles. So if you're going to be working with the client, as you said yourself earlier on, Phil, you may as well be working with what can help them in the long run. Make modifications to strength training. So what I would say is I think we'll come across exactly what that is in a second, but overhead lifting weights at a certain point, you'd make sure the weight was nice and light. You had a spotter in case there was any dizziness. Certain exercise like your seated row, your range of motion is going to be changed. Those kind of things are what we need to be aware of in strength training. Changing body position, like going from standing to sitting, from lying to standing, all those things as well. So I have a question. Yeah. A doctor does physical for a woman's body. They check your blood pressure, ask her on contraception. I definitely think a mammy MOT from a qualified physio is most important. Doctors neglect new mammies. Obviously, that's for insurance. Yeah. Very sad that mammies are so neglected. Sorry to get out my anger on doctors. Just maybe on my own. No, absolutely, Phil. I love doctors. They do a great job. But I think in pregnancy, women are let down a little bit in how much information we're given and how much help we're given. And not only in pregnancy, the whole thing, puberty, menopause, it's a huge area that's not addressed enough for women. So we make a start as professionals and we get the knowledge and we can help what we can around us. Again, as Phil said, the insurance, if you're working with pregnant clients, make sure you're insured to work with pregnant clients. That is the 100% the most important thing for you, that they have doctor's clearance, that they're okay to work out and that you're insured and qualified to work with them. Other than that, you can give them suggestions and advice and explain that you are not qualified, and that takes out the liability side from you. You're not telling them what to do. Okay, modify your supine exercises. So that's lying on your back. So if you need to move off the back, move back onto the back, that kind of thing. Awareness again. Stationary standing as required. So that's your blood pooling, like they said. You don't want to be stood in the same position for too long. You don't want to be sat in the same position for too long. You need to keep the blood flow going, and it stops that tightening and restriction through the body as well. It's just as with an average client, only the heart rate is increased with women, the blood pressure is increased, everything is increased to work with making that baby. So you need to just be a little bit extra aware of all the common things and just pay attention to them. Flexibility, make sure it's within a comfortable range. So remember, you're relaxing. That's the hormone. Relaxation techniques. That may not be you. That might be someone else you need to send them to if you don't do that. Breathing techniques. Some people, all they need is that breathing pattern when they're exercising to get relaxation. So it depends on the client. And God, I might say that a million times today, and I apologize, but it really does. Low impact aerobic exercise. So again, your joints are under strain a little bit. You have that intra-abdominal pressure to worry about, to be aware of. We're not going to worry about it. We're going to be aware of it. And you have that pelvic floor as well. So low impact exercises. You don't want to be hammering the life out of your joints and putting pressure on all your organs. Now, There's a question that was brought up in a previous webinar about, can you run if you were a runner before you were pregnant? That's different. If you were doing something before, your body has trained and adapted to that type of training, so you can continue it. You may need to ease off as your energy levels go or reduce, but a fit client is different to your average client. And fit, I mean someone who's very active. They would need just a little bit of modification and a little bit of advice, especially on that separation and things like that. But they could pretty much continue their workouts, barring the little changes we spoke about, like that's lying upwards, facing, that kind of thing. Okay, modify exercise which may cause a risk of overheating. So again, you might need to work in an air-conditioned area if you're indoors. That's why outdoors is great, or a pool. Not that any of these, I'm talking as if life is general right now, not that any of these things are actually accessible at the moment. So pools, out. Gyms, out. So if you're pregnant for the next 4 months, you needn't worry about any of that. You just go out, you get yourself some fresh air, stay away from people, obviously, because it's COVID now. But again, you deal with the situation, you deal with the client, and do your best. Choose exercises that don't exacerbate musculoskeletal conditions which may have developed during pregnancy. So that's your postural changes. So obviously, right, let's see. Your I think what would be a good example there. Your shoulders have rolled forward. You don't want to work those pecs too much and start to pull that in even further and not have the balance of working the back. So yes, you would still do the exercises you want to do with them, but you might have to change the ratio. So here is tight. We still want to work here, but here isn't working so much. So we do maybe 2 sets at the back and 1 set for the front. That kind of an idea. That's where your ratio would change. And that's for any postural issue. So exercises that you would avoid during pregnancy, any exercise that makes you sweat profusely, get exhausted or overheat. And that again will come back to your daily check-in with your client, because some days they might be more tired than others. High impact ballistic, that's those bouncing movements, stretches that you'd see. Now, this is an example. You wouldn't see pregnant women out playing football, because contact sport is another not recommended one. But ballistic would be those stretches you'd see footballers doing on the side of the pitch pre-exercise. Bouncy kind of movements. We don't want that. Quick changes in direction. So again, you have laxity in your joints. So that's the looseness from the relaxing. So quick changes in direction are going to put a bit of strain on those ankle or knee or hip joints and could cause an injury. So we avoid it. Again, none of this is 100% proven to be effective or ineffective for everybody, but what you're working with is guidelines to help you keep the client happy, healthy, and uninjured is the main thing. So no quick change in direction or from one exercise to another. So I'd be very short on my recovery. Women in general are great. We don't need as much recovery as men. So there's another bonus. But during pregnancy, you want to take your time going from exercise to exercise. You want to stabilize the heart rate a little bit and your respiratory, your breathing before you'd go to another exercise. There's plenty of time. And most likely she's just enjoying a bit of a change from feeling crappy and sick and no good to anybody, depending on the stage of pregnancy. Okay, so no stretching to the point of discomfort. So there we are. So there's your relaxing. You just want to be aware of it. If there's any pain or discomfort at any time, stop. Okay, no supine exercises from 16 weeks on. Now you'll find different variations of that, different time frames, different opinions. Work with your client. Pay attention to your client when they're exercising. Watch out for signs that they might be feeling a little bit uncomfortable or dizzy, or those kind of things. You really just need to pay more attention and be aware that there might be a need to avoid a supine exercise. Any exercise that increases risk of fainting, like strength training in a standing position. So again, that's one of your modifications that you could make to your strength training, is that, say, when you're doing an overhead press, you might sit to do it. Slight little changes. Any exercise placing a load on abs or pelvic floor. So that's it. Again, a load depends on the client what a load would be considered. So if someone is doing abdominal exercises, and they continue to do some for a certain amount of the pregnancy, that's still a load, but that's a load they can manage. Same with the pelvic floor. If the pelvic floor was something someone didn't even hear of before they were pregnant, which happens, as I said, as was said before, the knowledge that's out there for women is lacking in general. So they may not be aware that the pelvic floor is something that you need to work on and condition as at the start of pregnancy, so you wouldn't exacerbate or put too much pressure on that during pregnancy. Again, you wouldn't try and start a new program that's very different or very hard, or you wouldn't try and progress your current program when you're pregnant. So no contact exercises or exercises that might cause a fall or blow to the abdomen. Again, simple, obvious stuff. Now, I do remember my mom telling me that, please don't take this as advice, it's a mom story, so I'm sure we all have them. My mom telling me that a pregnant woman could fall down the stairs and there'd be no damage done to the baby because of the protection of the amniotic sac and that kind of thing. So there is protection in there for the baby, but we're not going to put them in a position where they may compromise that. So that's why we're saying no contact exercises or exercises that could cause a blow to the body. How about a barbell back squat? See so many trainers doing it online. I avoid it with my clients as I'm not qualified, but does it put pressure on their spine, or is it okay if they've been doing it before? If they've been doing it before, they could continue. Again, I wouldn't advance it. I wouldn't keep putting up the weight. Keep it at where they're able to maintain. You might even need to drop it, and definitely have a spotter. So again, this is someone who's training and physically fit and has been doing this for a long time. Yes, possibly. So again, you really need to know the situation of the client. Watching something like that on the internet isn't great, because then everybody thinks it's okay to do it. And there's people in the gym then going lifting weights on their own without support and without a spotter, trying to do these things that someone else has seen, they've seen someone else do, but they don't know their situation. They don't know what's going on there, whether that person has been hugely fit up to now, so you really need to just take your time with it. If your client insists on doing certain exercises and you think they shouldn't, purely for your own preference, you could do it with a lighter weight with them. Again, if you're doing you're going to have to get that barbell up over the head to get it down behind the head. So there's a lot of little sections in that I'd be breaking down to see if maybe it would be best avoiding that one and doing something else for that short time. Again, depends on the trainer, depends on the client. Okay, hang on. Yeah. If you are a fully qualified personal trainer with insurance, do you have to add pre and postnatal clients specifically to your insurance to work with them? I would say yes. I would say yes. Anything you can do to cover yourself, definitely. If you're covered to work with clients, I would still contact my insurer and ask them to say, am I covered? Was it covered in your training course? So there's a lot of little factors in that. I would definitely check with my insurance company. I would look into getting a CPD qualification in pre and postnatal, but then I would also get a disclaimer. So screening form and disclaimer, stating that if a client doesn't follow your instructions to the letter in a class, that whatever happens is on them. And that's horrible. It's horrible to have to do. It's horrible to even have to think. But you need to protect yourself if you're going to go into this area of training. It's not a reason to avoid it, though. If I've spoken to some male trainers before who will go, oh my God, I wouldn't touch that situation at all. No way, and everybody has the preference on that too. But I think there's too many of us stepping back going, no, I'm too scared to work with that. And there's too many people out there going around with no information on how to manage things. So even if you're just talking, giving advice, like doing a webinar like this, I would have a little disclaimer on it just to cover yourself. Do you do a course to qualify in this field? I have studied for 7 years but no qualifications. I will get in touch with you after the webinar about that and let you know. Okay, so during pregnancy, I'm going to have to speed this up a little bit, or we might need to run to 2 webinars. Okay, not today. During pregnancy, you want to do some aerobic conditioning. So you want to keep their heart and lungs working as best you can. Again, capacity is down, so be aware of it. Activities using large muscle groups. So you're going to have reduced time, you're going to have reduced energy. So exercises, if you're doing weight exercises, you would do compound exercises more so than isolation exercises, large muscle groups, because you get more bang for your buck, I suppose. Walking, swimming, cycling, low impact aerobic exercise classes or fitness machines. I loved the stepper or the cross trainer when I was training during pregnancy, because the impact was gone and it kind of half moves you itself. So 3 to 5 days a week, the lower end for the novice. So someone who's only starting out, 3 days would be plenty at the start. If they're going to make progressions, so if you have a client and you've been training them hard for years and they want to keep progressing their workout, the safest time is during the 2nd trimester. So the 1st trimester is danger zone, because that's when people don't tell anyone that they're pregnant. That 12-week mark is golden, because so many things can happen, so many things can change. So you definitely don't want to be pushing your body too much. Whether it have any impact or not is debatable, but you'll always wonder in your head, if that happened, did I do that? So you don't need that. So to make progressions during the 2nd trimester is safest. The last trimester, you don't have space, you can't breathe, you can't eat, your stomach is up here, so if there's going to be any progression made, that's when. That's not to say it has to be done at all. Again, plenty of time afterwards to progress. So if someone was previously fit, and if they continue to work with a more intense workout, then you want them to alternate an easy day to the hard day to allow recovery. So alternate days. Your training heart rate for a fit person, you'd look between 135 and 150 BPMs. Beginner, 120 to 135 BPMs. I'm not going to spend too long on this now because it's very technical. I will tell you that I was on a cross trainer and I was trying to keep it on 130. I'm not sure if that's BPMs or what. It was just a little button on the side. But also it was the music I was going to. I was trying to just keep to that. Couldn't always, but that was my goal. And it dropped to 128. Definitely. Although it was a while ago, so I can't really remember. You block it all out. Okay, what if a client stops training for 2 months or more in the 1st trimester because they've been sick? Can they continue to do what they were doing pre and early pregnancy, even with the break, when they feel better in the 2nd trimester? Okay, there's a couple of factors in that. If your client has been very sick, they may have a condition. I can't think of the name of it, apologies, but if someone's been getting sick a lot, their hydration isn't great. They can be very unwell with it. So their body can take a serious hit with that, as in your fascia, your muscles, your body function in general. If your hydration isn't adequate, you're going to suffer a little bit. So if they go through an awful lot of a rough start to the pregnancy, I wouldn't progress them or bring them straight back to where they were. Again, look, you're 2 months. So they say, and I love saying this "they say" thing, I read it somewhere when I was studying, but if you miss a week of exercise, and I could be wrong, it's been a while but I think if you miss a week of exercise, it sets you back 3 weeks effort. Now, you can, yes, thank you very much. I'm going to call that out in a second, Emma Jane, that was the word. So yeah, you miss out a week of exercise, it sets you back 3 weeks. Now, you have muscle memory. This is general, not just pregnancy. You have muscle memory and it comes back quicker. But if you think about that, if a client has stopped exercising or reduced exercise a good amount in 2 months, they really have to get back to, they have to build back to where they were. So I would maybe build them back to where they were pre-sickness, but I wouldn't progress it. I wouldn't push it any further. Now, let me see if I can say this word. Hypermesis gravidarum, sickness and pregnancy. Hyperemesis. I love these words. Yeah, that's the one. I had a client, she may be here, and I won't mention who you are, but I had a client who took me on as a personal trainer, and I can't remember if she was pregnant when she called me or found out shortly afterwards. She was pregnant. She was fit, she was pregnant, and she wanted to stay fit. So she called me because I was a pregnancy fitness instructor, personal trainer, and we met and had a little chat to see how we go. And then that poor lady ended up getting that excessive vomiting, that word I can't pronounce. It's in chat if you want to have a look, everybody. And I'll come back to that in a sec, Phil. But yeah, so she got that, and she couldn't exercise at all at the time, and she was devastated. She really wanted to do something, and she couldn't even walk, go for walks. So yeah, everybody has an idea in their head of how it's going to be, and then you just have to deal with what happens. So I will confirm this before I'm going to say it again, and I may be wrong, so I'm doubling up on this, Phil. But I'll confirm it, and I will post it on my Instagram. So my Instagram is Sarah Hearn Fitness, and I'm going to post a little thing later on to confirm or deny this, what I'm about to say. The exercise, that if you miss a week of exercise, it sets you back 3 weeks of progress. Sounds awful, doesn't it? So when you go on your week's holiday, you're set back 3 weeks. Now, I suppose if you were to walk a little bit and move a little bit and keep yourself active, it might help. But anyway, different topic, different webinar. Okay. Strength training, I'm going to fly a little bit here just to catch us up because we haven't got to post-pregnancy and we have 25 minutes. Apologies, lots of questions. Strength training, light to moderate weights, use of machines, prevent risk of dropping the weight. So these are options, not 100% recommendations. Again, go with your client. Include abdominals. In the first trimester, you can work on abdominals. Pardon me, losing my voice. When they say abdominals, just remember it's the rectus abdominis that separates during pregnancy, so you can still work those abdominal muscles. There's more than that one there. Back extensors, so all the way up the back, glutes, rhomboids, traps, so that's all the back muscles, those muscles that are going to be affected by your postural changes. External hip rotators, so that's we already have that internal draw from our body position, our pelvic position, so we're working on balancing that out, and also you're going to need to be able to move in that position at some point. Pelvic floor and quadriceps. So quadriceps, that position that lady's in is a possible birthing position. So imagine if the person wants to stand to birth the child, they're going to need strong legs. I wasn't allowed. I had to lie on my back, even though I really didn't want to, but this is how it is. Disuse atrophy. So important is daily exercise activities. Sorry, I'm losing my track here. To prevent muscle atrophy. So you don't want muscle wastage. You need to keep a little bit of strength going. You need to keep a little bit of stability going, at least to get you through the birth. That is a very difficult time on the body, and any bit of strength you can assist with is good. Disuse or atrophy of the muscles then leads to spinal problems or more postural problems. As the uterus enlarges, the breasts enlarge, and kyphosis and lordosis can be an issue. So that's the curvature of the spine. Kyphosis is the top, so an exaggerated curvature here, and an exaggerated curvature of the lower spine as well, where that tummy is pulling forward. Okay, so the kind of fit principle for exercise training we're looking at, for strength training, it should be modified for stages of pregnancy. For example, modified squats, more comfortable than the leg press because you won't be able to get the thighs close to the abdomen. So those little things to think about. So for strength training, you're looking at 2 to 3 times a week, light to moderate weights, 8 to 10 exercises, and that's down to you and your client. You're looking at major muscle groups, and at 4-month mark, remove the supine exercises, because of that reduction in blood flow. Pelvic floor exercises should now be part of your daily routine. So your pelvic floor is going to function to help push, and it's also going to help keep your insides in and other stuff that you don't want coming out during your birthing. The benefits of the abdominal exercises during pregnancy is it keeps your abs strong, minimizes lower back pain. So you know about muscle balance. If there's a weakness on one side and a strength on the other side, that weakness is going to be compounded and made worse. So you have to try and get that balance. And even during pregnancy, a little bit of awareness in trying to balance the abdomen help with posture. So are abdominal exercises safe? This is at the discretion of the pregnant client with doctor or consultant, all clear. Crunches or sit-ups. It says here there's been research to suggest crunches are safe in the first trimester. After that, you're looking at the muscle separation, and if you are to crunch, you can actually exacerbate that and make it a little bit stronger, which is not something you really want to do. So it's those sit-ups and crunches that we wouldn't be advising after the first trimester. Diastasis recti is the condition that we need to worry about there or be aware of. These exercises also simply become uncomfortable as pregnancy progresses. So again, deal with your client. See what's comfortable, what's not comfortable for them. They need to give you a lot of feedback as they go because things change day to day. Okay, so they're not essential abdominal exercises, but it is important to know whether you can do them or not and why you can do them. And I'm throwing stuff around the room here, sorry. The flexibility, again, important to do it, but you need to be aware of your safety. Include as part of your warm-up and cool-down. So you have your dynamic, which is moving stretches at the start, not ballistic, so keeping it controlled movement. Part of your cool-down then is your static stretching, so just to the point of discomfort and don't overstretch. Focus on the tightened muscles, the shortened muscles we were speaking about before. How do you know if you have ab separation? I didn't, so yeah. I would assume for your client during pregnancy that there is a possibility they have it, but you can't really go at the stomach. You don't really want to be. After pregnancy, you can test it. Hopefully we can get to that in a second. Let me see if I can just, here we go. Who keeps asking me questions right before the slide? You're brilliant. You're right on the ball. You know what's coming before I do. Okay. Diastasis recti during and after pregnancy. So there's a little picture there. On the right is what it looks like. So the rectus abdominis is down the front and those muscles separate. That little line down the middle is a connective tissue. So it's not a problem. It's made to allow movement. So this is natural, this is normal, and it's awareness of it. Again, for these changes, if a client has diastasis recti or separation during pregnancy, you might need to look at different body positions. So you could do your glute bridge here, like on the right. But if you were to do that bird dog exercise, which is just down below, as you can see, that's going to put an awful lot of pressure on a separation that will be there. So I would leave those exercises out towards the end. Hang on, sorry, can't see slide. Sorry, Bree. This one, was it? That one? I'll send you slides anyway. Those definitely, the people who are doing this as a course, I'll be sending the slides and hopefully I'll be able to get permission to send the rest of you the slides too. So, okay. I'm going to skip a little bit because I've covered this. This is your recommendations for active and inactive clients, what to do and things like that. So we have covered it, don't worry. Impact, again, this is just a little bit more about the changes in the center of gravity, the shortening of muscles. We spoke about that in general. This particular slide just kind of goes into a small bit more detail on it. Again, I don't want to overload you. So resistance training, just remember your joint vulnerability is a concern. So just to be aware of it. When the bump develops, you might need to reduce your range of motion. All those things you need to work around your client and not to worry too much about the mobility part of it. When it gets to that part where they can't actually move, you're just keeping them active and try not to hurt anyone. Okay, postnatal. Wow, right, flying. Again, you're looking for about 150 minutes a week. Again, think about it as if this is the first 12 months. They recommend that you build back your strength. I'm going to skip a second because there's more information here. Okay, so the GP will allow some women to return to exercise after 6 weeks. You have your 6-week checkup, and then the GP will advise whether you can return to exercise or not. That's for a regular vaginal birth. Sometimes that checkup will occur at 8 weeks. God knows what the situation is now during COVID, when you're seen or if you're seen, but always get your GP's clearance after pregnancy to return, because they'll have your questions to ask about prolapse, if you have any organs that are prolapsed, those kind of things. You need to know these things before the client comes back anyway. Cesarean deliveries can be 10 to 12 weeks before they can return to exercise. So you need to wait for that scar tissue to heal so that the scar tissue is not being compromised by exercise. It has to be healed before you can return. Now that is general exercise. Okay, you can start pelvic tilts, pelvic floor exercises from the second you give birth. You won't want to, but you can. So returning to structured exercises, verbal screening is very important every day. So again, just like with your pregnant client, the post-pregnant client is going to have a load of emotions and issues and energy levels and everything going on, and you need to check in to see what's happening with her that day, what she needs from you. She might not need hassle about doing exercise, so you might not need to do something a little bit light and easy so she feels like she's winning on something. You know, depends on your client, so get to know them. Clothing and footwear is important post-pregnancy. Bras, make sure that the proper control for the bra, because that you put on weight in the chest. If they're breastfeeding, it's going to last for longer, and you want to make sure you're not putting any extra pressure on that area. Footwear, again, your foot could have changed. Some people's feet change size, they grow, they get smaller. So again, just to assess that as they go. Again, this is for your client to do, not necessarily for you. Why would arches fall? I don't know. Let me think. Yeah, you're ahead of me again. Okay, so arches may have dropped, foot size may have increased. I'd say to do with gravitational pressure and shifting of the weight over the joints. So it's an area of the foot that's not designed not to take that much pressure and not to take that posture, and now it has to. So it's any number of things can happen. I don't know for sure. Breastfeeding before exercise may cause leaking and embarrassment. Again, any impact exercises, the client, you're going to have to be aware. She could wet herself, she could leak. There's just so many little things we have to be conscious of for that woman. Also, she might have to bring the baby. Again, this is not COVID, another time. But being able to bring your baby with you is huge. Being able to stop and start and go over to the baby, those little things can be massive for a woman post-pregnancy, just to get out of the house, somewhere that she can move and feel better and be in discomfort for a choice of her own. Plenty of fluids before and after exercise, and food intake at least 2 to 3 hours before. So again, just common sense kind of things. If she eats close to exercise, she may be ill. If she doesn't eat, she might be faint or dizzy. Gentle exercises in the initial weeks regarding pelvic floor muscles, breathing exercises and relaxation methods are where you start. Okay. Pelvic floor muscles, you want to help your client understand what a pelvic floor contraction feels like and how it should feel to relax that pelvic floor. Then it's getting them to, just like you would any other muscle in the body, so contract and relax, contract and hold, different amounts of time, different amounts of resistance, that's not the word, clench. So you would even go, so a client might be able to clench to 50%. They might not be able to get to 100%. So you can work on the strength, and you can work on the, words won't come to me sometimes. Longevity, that's not the word, but the, yeah. So you work on different elements of it. The length of time you do your contractions, the amount of contractions you do, so reps, sets, force. So post GP checkup 6 to 8 weeks, if they're given clearance, they can return to structured exercise. All those things that I spoke about before with pelvic floor muscles, breathing exercises, relaxation methods, they can be done previous to that 6 to 8 weeks. Breathing exercise is very important because we need to connect the mind with the diaphragm, the pelvic floor, and the core again. That brain-body connection is a little bit askew after all them changes in the body, so that's very important to get that back. So cueing as to where the client should be feeling the breath, that kind of thing, having them place a hand on the muscles that you want to expand or contract when they're breathing, all those little things to draw back that brain-body connection. Thank you, Margot. Catch you the next day. Margot's dotting off. Okay, after a cesarean, you have 10 to 12 weeks post GP checkup, and then you get your clearance again. So always wait for clearance. Okay, I am going to skip a little bit. With your post-pregnancy client, take all the precautions that you would to do with energy levels and ability as you would when they were pregnant. But just be aware that this is a person, they haven't been ill, they've just been a little bit incapacitated slightly, and they just want to get back to normal. They just want to get back to doing what they feel they can do. And you need to guide them a little bit in that and slow their roll a little bit. So recovery of the pelvic floor, you have an episiotomy. Doesn't always happen, but it can happen. Used to always happen. If you've watched Call the Midwife, I think it was, they used to do an episiotomy on all women. That is an incision made to enlarge the vaginal opening during birth, and that can take 10 days to heal, but the stitches can take up to 6 weeks. So these are things that you might need to be aware of. If a woman mentions she has had this done, so you know what's happening, but also her doctor will refer whether she's available to come back to work or not, or to exercise. Cesarean section or C-section incisions, the healing time can take 10 to 12 weeks, very much dependent on the client, on the woman, and what they're doing to help that healing or exacerbate it, whether there's infection or not. All those things can change the situation. Women who deliver through cesarean, so if you get the stomach cut to have the baby removed, you still need to work the pelvic floor afterwards. So even though the pelvic floor hasn't released the baby, it has worked, it has stretched, it has moved, it has weakened, all of those things throughout the pregnancy, and needs to be rehabilitated afterwards. Okay, and here we are. I think this may be my last slide. I'm going to give you a tiny bit of information then before I go. Quick check on the questions. So pelvic tilts, the most important thing post-pregnancy when you're coming back to exercise is to get that pelvic floor and the pelvis itself back into neutral. So pelvic floor strong, but functional strong, contracts and relaxes. And the reconnection of those muscles in the abdomen. Okay, so you don't want to bring the head up in this lying position. If you bring the head up, you're contracting the rectus abdominis. There may be a separation there. Some women don't get any separation. Some women do. I'll just finish on that actually. I'll tell you a little bit about the diastasis. But pelvic tilts are good for working where women want to work most. So under the belly button. So when you move your legs towards your chest, or in this case, we're not at that stage yet, we're literally tilting the pelvis towards the front, towards the anterior. In this position, we're looking at training those muscles below the belly button. So that little pouch that's always left after pregnancy, that's where we're looking at hitting. Now, when women come to you and they've been pregnant before at any point in their life, or they have that abdominal weight, a lot of women will ask for abdominal exercises to fix it. And they will help, but it's about reconnecting the core, the breathing, that pelvic floor. It's all connected. If you have a look at a diagram of your core, the canister, you have your diaphragm on the top, you have your pelvic floor on the bottom, your abdominal muscles are at the front, and your back muscles are at the back. And that's a canister that needs to work in good unison for there to be a functional working core. So that's at all times. In pregnancy, you're looking at trying to rehabilitate that and bring that back. or get it in the first place. It's a great time to start if you've never had core. Post-pregnancy, you can break it right down, get right back down to the start and build those levels again. Until the muscles get stronger, you'll not receive the full benefit of this all-in-one exercise, which they call the pelvic tilt standing position. So start lying down in the bed. You can do this in your bed to start with. Another thing about the bed, after pregnancy, you want your client, again, let me say, we don't want to sit up. Most of us sit up to get out of the bed, especially if you're jumping up to a child. It's like natural reaction. But you try and encourage them to roll. So if you can control a roll out of the bed, and again, alternate sides, different days or whatever, you're working that transverse abdominis, so that wrapping muscle around the stomach that helps you roll out will also start to bind back in that tummy and start to pull you back in. Okay, let's check in my chat here. Okay, I'll read it to you. My last baby, we got a handout in the hospital to do pelvic tilts and belly breathing. Didn't get it on any of the others. So they are really starting to educate women. Yeah, they are. That's fantastic, Phil. I don't remember. I think, to be honest, whether they give you something, if you're not in a fitness mind like you would be, Phil, and myself sometimes, but I think they could hand you anything and you're walking out the door of the hospital, and as long as you have the baby, you're kind of all right, you're just floating along. So maybe it's not the best time to be giving women advice on what to do just after they have the baby. I did see that they had physio for post-pregnancy. I went looking up the guidelines for Ireland, and I came across the HSE page that gave us some information for after pregnancy and pelvic tilts, and it was wonderful. There was loads of information in it, but I had to look for that, and it is 3 years later, so maybe they're getting it now, maybe it's been handed out now and it is progressing. I really hope so, because it was a huge oh, pardon the puns, huge gap in the market. Okay, thank you for all your questions, thank you for the chats. That is so true. The amount of leaflets we get, I focused on exercises because it was in my field and I dumped the rest. Exactly. You pay attention to what you can take in at the time, and you just too much information on the rest. And you're lucky that you knew the exercises were important. A lot of women don't. If we aren't made aware of the importance of pelvic floor function, and this isn't only women, if there's any men out there, I'm checking the time, if there's any men out there, you have a pelvic floor too. It must function, or else you won't function sexually or urinarily. You won't be able to pee. So these things are very important for you too. So just to remember, it's not all the poor women that get all this stuff. You got it as well. Except for the diastasis we get. Some of us have an excuse. Men, you've no excuse. Baby thing. Okay. Let me see. Bree, yes, thank you very much. My puns, yeah, I'm terrible. I forget I'm talking sometimes. Hey Phil, you're with Joanne. Hi Joanne. Right guys, before I go, diastasis recti, how to test it. See that way that woman is lying on the ground? I could show you myself, but my poor abs are in awful condition. I have done nothing the last 6 months, so I'm not going to show you mine, but I'm going to tell you on this woman real quick. And I have a video on YouTube as well. As I said, Sarah Hearn Fitness, look me up, YouTube, Instagram, and I have extra bits. This woman here, the way she's lying, right? See, the top arrow is pointing down at her belly button. So what we would get her to do is walk her fingers up her belly button. Let's see if I can stand up. Her belly button, so there's her belly button. Fingers up, a couple of inches just above, while she's lying like that. Then we ask her to well, actually, the instructor can put the fingers in. Then we'd ask her to do the crunch, that thing they were telling you not to do. We get them to crunch, and you'll feel the separation there. Now, that's while lying. If you're pregnant, post-pregnant, please don't do it if you're pregnant. Post-pregnant, give it a go. Check out the YouTube, check out the Instagram, and there are some more videos on testing it there. I'm going to finish up now because there's a few hellos and chats coming in to say goodbye to everybody. Thank you so much for sticking with me for the hour and a half. A little bit longer today. Thank you very much. And any questions, send them on. and I'll get back to him as soon as I can. Who's already stalking me off? Yeah, I'm reading the chat here. I hope you are too, because otherwise it don't make sense. Guys, thank you so much. Will I leave the test the abs, or would I test the abs or leave it to a physio? I would test it. Because I felt it on myself and I felt it on other clients, I would test it. But if I couldn't find it or couldn't feel it or I wasn't sure, ask the physio. Yeah. Sometimes the client won't want to put their fingers in there themselves. So yeah, it depends. Again, as I said so many times today, and I apologize for repeating myself, it depends on the client. Okay, guys, any questions, send them on, and thank you very much. I will log off now because I have mobility and flexibility coming up soon, and I'll see the rest of you guys after the break.